This is my continuing coverage of the health care bill. We are on page 63. We are now talking about standards. In general, the Secretary shall establish standards for navigators under this subsection, including provisions to ensure that any private or public entity that is selected as a navigator is qualified and licensed, if appropriate, to engage in the navigator activities described in this subsection and to avoid conflicts of interest. Under such standards, a navigator shall not. Okay, before we go into this, what this is saying is that to be qualified as a navigator, you have to meet a certain criterion. Who sets that criterion? Well, that's the Secretary of Health and Human Services. So, the Secretary of Health and Human Services determines whether a person is qualified to be a navigator or not. Okay. Under such standards, a navigator shall not be a health insurance issuer. In other words, if you're working for Blue Cross, Blue Shield, or you're working for United Healthcare, or you're working for some other insurance company, you cannot be a navigator for this health insurance exchange. Okay? Or 2, receive any consideration directly or indirectly from any health insurance issuer in connection with the enrollment of any qualified individuals or employees of a qualified employer in a qualified health plan. In other words, if you're working on the exchanges and some health insurance issuer like Blue Cross Blue Shield says, hey, look, if you'll enroll so-and-so and so-and-so people, I'll give you a monetary bonus, or I'll give you a free trip to Hawaii, or something like that. Navigators can't accept those gifts. That's what that's saying. Fair and impartial information and services. The Secretary, in collaboration with the states, shall develop standards to ensure that information made available by navigators is fair, accurate, and impartial. Okay. So, in other words, you're not going to get biased information from these healthcare exchanges. Funding. Grants under this subsection shall be made from the operational funds of the exchange and not federal funds received by the state to establish the exchanges. In other words, the exchanges have to figure out some way to make money off of this, because the federal government's not going to sponsor these people. Applicability of mental health parity. Section 2726 of the Public Health Service Act shall apply to qualified health plans in the same manner and to the same extent as such section applies to health insurance issuers in group health plans. Okay. Conflict. An exchange may not establish rules that conflict or... An exchange may not establish rules that conflict with or prevent the application of regulations promulgated by the Secretary under the subtitle. Okay, what that means is that when the exchange establishes its rules for its employees, they cannot conflict with what the Secretary of Health and Human Services has said, nor can they prevent the rules that were established by the Secretary of Health and Human Services from being implemented in the exchange. There you go. Alright. I will tell you more in a future video. Stay tuned.